In the first 59 days of life, a baby's biggest threat can be invisible. Possible serious bacterial infections claim the lives of more than 550,000 infants globally every year. Now, the World Health Organization insists hospital care is critical. But what happens when the nearest hospital is hours away or unaffordable? For thousands of Nigerian families, that is the reality. Now, since 2015, WHO guideline has offered an answer: simple, effective care that can be delivered close to home when referral isn't possible. On the Correspondents this week, we'll examine how Nigeria identifies and manages these infections in newborns. What works, what's missing, and how do we save more young lives? Hello and thanks for joining us on the program. I am Zenret Dingmun, and thank you for being there. Globally, over 550,000 babies aged 0 to 59 days die in a year from possible serious bacterial infections. The World Health Organization recommended hospital care as critical, but for thousands of these babies, hospital is not possible. In this report, Uche Ugochukwu tells us how these infections in neonates are identified and managed to reduce mortality.
What you just heard is the sound of possible serious bacterial infection, PSBI for short. It could be sepsis, pneumonia, or meningitis. This is suspected if a baby less than 2 months breathes fast, runs high or low temperature, reduces movement, or won't feed. In Nigeria, it is one of the fastest causes of newborn deaths.
So at the primary healthcare level, because of the peculiarity of those settings, where they do not have the backed up laboratory services, so the identification of the etiological agents will become difficult. So that is why they are classified in the Integrated Management of Childhood Illness algorithm, which is operational at the primary healthcare level, as possible serious bacterial infection. So at this level, and the classification called possible serious bacterial is linked to treatment. So when the health worker at that level identifies the young infant as having a possible serious bacterial infection, there is an identified and prescribed treatment, which is in the IMCI algorithm.
Some of the infections in newborn, which we call it low mortality risk signs, can be treated outside the hospital with an antibiotics, which is oral, and 2 days of gentamicin. Another important finding that not all the newborns and young infants need to be hospital for 7 days of injectable antibiotics. They can be discharged earlier after 48 hours of antibiotics and supportive care within hospital, but then on oral antibiotic they can go home and continue their treatment for the next 5 days.
Experts warn that the outpatient care does not replace inpatient management when the need arises, and close follow-up is essential for young infants managed on an outpatient basis where referral is not possible. In all, identification and management of possible serious bacterial infections and proper hygiene are essential in reducing deaths from infections in young infants.
Uche Ugochukwu joins us now to shed more light on this issue. It's good to see you on the Correspondents, Uche.
I'm glad to be here too. Thanks for having me.
All right, let's start with this, Uche. What exactly are those possible serious bacterial infections in infants 0 to 5 days? And what are the most common signs a parent or health worker should watch out for based on the WHO guideline?
Okay, thank you. The commonest serious possible infections in young infants are mostly pneumonia, we have meningitis, and we have sepsis. And the signs, of course, that parents and healthcare workers should look out for is when a baby is having severe high temperature talking about high temperature when it's more than 38 degrees Celsius, or low temperature when it is less than 35 degrees Celsius. We'll look out for infection, bacterial infection. When a baby is having a severe chest indrawing, another one is when a baby breathes fast, as when the breathing it's more than 60 breaths per 1 minute. Of course, the parents or healthcare worker should suspect serious bacterial infection. Also, when a baby it's not feeding well, you look out, that's a sign. Another sign is when a baby does not eat, refuses to feed, you know that something is wrong. We look out for infection. And one other sign is movement. When there's a reduced movement in the baby, that's a baby does not move until being stimulated, then a parent or the care workers should suspect serious bacterial infection in such babies.
Okay, now, Uche, when you discover some of these signs, what do you do? Is there something that the parent can do maybe when you're at home, or is it something that you have to rush to the hospital? What do you do in case of an emergency?
Yes, according to WHO's guideline in 2015, of course, WHO recommends hospital is the first point of call for any ailment. It always advises anyone goes to the hospital. But when this happens, maybe at night or when a person cannot go to the hospital, there are also two recommendations. One is when a parent cannot go to the hospital, there are medications that were recommended. One, gentamicin, that should be given to the baby. And the second antibiotics is amoxicillin, of course, with certain recommendations, dosages. But then it's also advised that in as much as you give this as emergency, maybe when you cannot get a referral at the moment, after administering this antibiotics, at any possible time, ensure you also take the baby to the hospital for a follow-up. But if it's in like very rural areas where maybe the hospitals are not there, of course we have the choose, that's the community health workers. It also advises the community health workers to also go and visit for checkups, you know, not just administer the drugs or the antibiotics and sit back at home. No, you must also follow up and ensure you take the baby to the hospital. So that's the gentamicin at the time and the amoxicillin that you administer in the home doesn't mean you should just sit at home. The parents should also endeavor to do a follow-up at the hospital.
Okay, so you've mentioned a bit of the main barriers to hospital referrals. Can you elaborate more on that? What are other issues that causes, you know, lack of barriers rather to hospital referrals in Nigeria? I know you've mentioned rural areas and all of that, but I think there are more, isn't it?
Of course, there are more to, let's call it hospital visitations.
Okay.
You know, like in certain communities, the nearest hospital may be far away from the people, you know, so in that situation, going to the hospital may not be possible. Secondly, when we have security issues, when the parents, of course, cannot go out, even when the hospitals are there, but maybe at that time. And mostly, you know, as we believe, illnesses usually come at night. You know, when it comes and the parents cannot go out at that time, what do? You know, that is where the outpatient administration of medication comes in. So usually, in this case, they choose because they are trained, of course, to do that. So we also have our cultural beliefs. Some people up to now do not believe in hospitals. They do not trust going to the hospital. And that is why let me say, in the Northeast, according to reports from the Ahmadu Bello University Teaching Hospital, that I think about 33% of children die as a result of possible serious bacterial infection. And some of them do not get to the hospital before this. Of course, remember the age is just 0 to 59. That's less than 2 months. So many of them don't even get to go to the hospital before that happens. Some are cultural barriers, culturally in the sense that they believe they should be in the house in as much as the advocacy is on for parents, for babies to be born at home, in the hospitals rather. Yeah. But some cultures still do not accept that. They believe they can't do it at home. My mother-in-law can do it, my grandmother can do it, or this person can do it. And all these are what is still fueling mortality, infant mortality in our country today.
And that also affects the mother, isn't it?
Of course, sure.
Okay. Now, Uche, before we continue our discussion, let's take another report from Maiduguri on the impact of bacterial infections on young infants, put together by Ijapari Joseph.
Health professionals emphasize the importance of facility-based deliveries to enable early detection and prompt management of infections through proper screening and follow-up care. These, they say, can significantly reduce the risks of bacterial transmission to newborns.
The bacterial infection nowadays, when you look at it, on the 1-year-old child, that is an infant, can even take that one through the nosocomial infection in the facility. That's why, unless if the child is being taken for immunization, we don't encourage mothers to be taken under 1 children for even facility visit, because they will be predisposed to a lot of disease of public health importance, especially the bacterial infection.
They also note that ongoing sensitization campaigns are being carried out across communities, including rural areas, to encourage mothers to seek medical consultation for their infants at healthcare facilities.
Women should actually, during the 1,000 days of life, that's especially for the infant, they should emphasize on the vaccination for all the vaccination schedule. For the child immunization schedule, they should make sure the child got all the vaccine he's supposed to get. And then the other thing, the child should be well breastfed.
Experts caution against the misuse of antibiotics, warning that improper prescriptions can lead to antimicrobial resistance, which may complicate treatment and endanger the lives of infants. As the saying goes, prevention is better than cure. Mothers and caregivers are therefore advised to maintain proper hygiene and avoid exposing newborns to unsafe environments, which may increase the risk of bacterial infections.
What we are saying virtually is the governor has built a lot of facilities spread across the entire 27 LJ. The best thing for a mother that can do to a child is to make sure whatever it is that is happening with a child, they should take it to the facility for consultation. That way, the expert will identify the problem and do the needful.
In the rural areas, we are facing so many challenges which are not familiar. Sometimes the doctors could say it is a bacterial infection, but with government intervention, by expanding healthcare facilities, we had to reach areas. Most of the challenges have been addressed. Since the expansion of the healthcare facilities in the rural areas, we have been able to get medical attention. Sometimes the doctors would tell us it is bacterial, which we don't even know. But with the medicine they give us, we see that there's improvement in our children. And we say thank you to the government for this intervention.
And back to our discussion now, Uche, can you tell us about community awareness? How can we improve community awareness and community involvement, so that we can look out for some of these things, especially since we have established that cultural, issues are part of, why we have the high mortality rate in infants?
Well, talking about awareness, I think I will give it to the Ministry of Health in Nigeria. We're looking at the NGOs and both individuals who have been going out, to sensitize the people about on the need, in fact, to reduce infant mortality in our country. And this is all about taking hospital visitation seriously and adhering to instructions, as in visiting our doctor, changing our attitude, our healthcare attitude, or let me say health-seeking behavior in our country. This is actually what is pulling us down. But for awareness, a lot of people already know. Let me put it that way. They're already aware, but the thing is, the ability to change our attitude, to change our behavior. I think that's what some advocates are actually clamoring for now. It's not just do people know, but the ability for them to accept what they have been told to do, the ability to change what they already know, to unlearn.
All right, so Uche, you are one of NTA's health correspondents, and we know that health is quite the sector, very wide and challenging. Tell us your experience, challenges you faced, and what has helped shape you as a reporter covering the beat.
Well, my experience, it's been a good one. It's health. We learn every day, and in the process of coverage, especially when you want to do special reports, sometimes accessibility is one thing. The ability to go and meet the people where they are, especially those in hard to reach areas, we find it very difficult. Like, I want to do a report on, let's say, I want to go and meet like this women with who have experienced maybe death of their children as a result of serious bacterial infection, or I want to be there when the baby, where the babies are, to go and meet them, those that have the infections and what have you. I may not have the mobility to go at that time. I know news is all about time. Time is of essence in news. You don't wait eternally. So you need to move at the time. But most times you want to move, you cannot move because one, the mobility is not there. Secondly, you may not have the required tools you need to go there to get to those places. And then again, cultural barriers. We still talk about this, religious belief, cultural beliefs. When some things happen, you may ask, okay, please come and tell me about this, share experience. They say, no, it's the will of God. God has brought, he has taken. So it is like that. It is, if God does not will, it will not happen. Yes, if God does not will, it will not happen. But we also have our parts to contribute. So letting those people, convincing them to speak up is one thing.
Covering health, you get to visit hospitals and maybe places where, are not, if I may say, unhealthy. How do you get to protect yourself when working on such reports that, take you to some places that might maybe be prone to diseases?
Well, that's one of the hazards of reporting health, actually. But as an individual, I have to do my bits. Of course, whenever I get into a hospital, it is traumatizing for me. There are ailments that when I get to the wards where the patients are, whenever I come back, I am not able to eat. I remember when I covered a surgery, a knee replacement surgery. When I came out from the theater, for like 1 month, I wasn't eating meat. I couldn't just eat because it was so traumatizing. Same thing happened to me when I covered an open heart surgery. I got back to the office. Thank God I was able to put down the scripts while I was there. Because immediately I came back, I dropped my script. I gave the producer the script to edit. I as good as passed out. I couldn't do anything again. So, but thank God I had done the script. So the producer had to take over that script and everything to finalize it. It was so traumatizing for me. It's not easy. But then, while you're in the field, your attention is just, let me file in the reports, let me get out my reports. You're not thinking about anything. But when you're back, that is when the replay of what happened will really get to you. And that is when the trauma comes. So I, of course, like whenever I get to the hospital, I get to the hospital. Of course, when I come back, the first thing I do, of course, hand washing, hygiene, personal hygiene is very important. As wash your hands with soap and running water. We always do that whenever you get to such places. And if in some situations you must wear your face mask, like entering a theater, you don't need to be told to wear your face mask for your safety and also for the safety of the patients there. And all of that, just personal hygiene and being cautious, that awareness and consciousness of being safe also is also very important. It helps as well.
All right, Uche, quite interesting there, your experiences as a health reporter. Thank you so much for shedding more light on this topic, Uche, and we hope to see you again on the Correspondents sometime soon.
It's my pleasure. You're welcome.
All right. Let's pause here for some messages. Please stay tuned.
Our major currency unit is the Naira, while the minor unit is the Kobo. They are both in notes and coins. The Naira is more than just a medium of exchange. It bears the images of our heroes. So, stop abusing the Naira. It is a criminal offense to spray the Naira at events. Stop stepping on the Naira. It's not your enemy. Do not squeeze, ruffle, or write on the Naira. Handling the Naira with dirty or oily hands can deface the Naira. Love the Naira as you love yourself. Be a real Nigerian.
This message was brought to you by the National Orientation Agency, NOA.
Welcome back to the Correspondents. Now, infectious bacteria remains one of the leading threats to newborns worldwide, responsible for roughly 33% of neonatal deaths, and half of all deaths in children under the age of 5 are linked to infectious bacteria globally. Now, this, medical experts recommend urgent medical evaluation if mothers notice fever, poor feeding, or breathing difficulty in babies. Doris Akumoye has more on this.
Infants are among the most vulnerable populations to infectious diseases due to immature immune system. This first year of life is a critical period as their defense are still maturing and they rely heavily on material antibodies for protection.
He had this breathing, he breathes heavily as if he's snoring. So I took him back to the doctors. They gave me a particular medicine that I should use once a day. And he also had colic, but they said colic does not have cure. So if you just watch over the child and keep him safe and healthy.
Experts say infectious diseases in infants can lead to serious health implications if not properly diagnosed and treated.
At early age, we are talking about a retroviral that causes acute diarrhea. It comes, as I said, using the feeding bottle. Baby will come up with stooling and vomiting. That's the first symptoms you may have for retroviral infection from diarrhea. Fever can also come up due to maybe you have a small baby in the house that wants to carry his or her little brother. You don't know what the baby might have touched, carried maybe shoe or something and put in the mouth or use the hand to touch. You can go and touch that newborn baby and the baby, before you know, baby will be having fever.
When you give birth to a child as a mother, in order to manage it, the first thing you should do is, first of all, hygiene. Your hygiene, because one, the immunity of that child has not been built up. So that child is exposed to everything that comes around until that child is fully immunized.
First 3 loose stool in a day or more than, you have to go to the pediatrician. You seek for a consultant pediatrician, or you seek a medical attention immediately. Why? Because as you doing self-medication, you may not know the accurate dose to give to this child.
For experts, with prompt intervention and proper medical treatment, infants can overcome infectious bacterial attacks and continue to grow healthy. In Yenagoa, Doris Akomonye, NTA News.
Thank you so much, Doris, for that report. A critical message there for every family with a newborn. And with that report, we conclude the correspondence this week. Thank you for being part of it. And from all of us here, it's bye for now.